Good afternoon. My name is Christy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy. Good afternoon, everyone. Today we're reporting 0 new cases of COVID. But I don't want to forget that yesterday we had a death. I want to extend to the family and friends our sympathy from all Nova Scotians to your loss. It doesn't get any easier, but it is a sign and signal to all of us that COVID is still here and we all have to remain vigilant. That said, we are making some progress, and this is an important day. Many of you are open for business. I want to thank you for your patience and congratulations to you for having the courage to open your doors. This has been a difficult time in our province, there's no question, but today feels like a new beginning. Thousands of high school graduates are also preparing for new beginnings. Under normal circumstances, they would be getting ready for an elaborate graduation ceremony and prom. Sadly, this year they can't do that. High schools will recognize and honor grade 12 students receiving diplomas in a way that follows public health protocols. But it won't be the same. Many communities have recognized that and have stepped up. And we have received a number of proposals from communities wanting to celebrate their grads. Dr. Strang has taken a look at them, we've talked about it, and we like them. So Dr. Strang is granting an exemption with a strict set of public health guidelines. He will go into those details in a moment. I want to say thank you to the families and communities who think so much of their young people that they want to find a way to honor them and give them that special day. To the class of 2020, I know the last few months of high school have been difficult, away from your friends, your teachers, at a pivotal point in your education. I am so proud of all of you for adapting during this unprecedented time. And as you are moving on from high school, take this experience and learn from it. And use the strength that's given you to put kindness back into the world. You are our future leaders, and I have confidence that you will do great things. As you celebrate your final year, be proud of yourself. It is a huge accomplishment, don't you think, Dr. Strang?
Absolutely, and I echo those remarks. Congratulations to all the graduates of 2020, and I'll come back to that in a minute. But again, also like the Premier, I do want to share my condolences with the family who are mourning the loss of a loved one. The death that was reported yesterday involved a male in his 70s living in the Health Authority Central Zone who had underlying medical conditions that led to contributed to his death from COVID-19. That brings the total number of COVID-19 deaths in Nova Scotia to 61. Today, as we head into the weekend and a lot of businesses starting to reopen, it is very pleasing to be able to report that for the second day in a row, we have no new cases of COVID-19. So the total number of confirmed cases remains at 1,058. We have one long-term care home with active cases. That, of course, is Northwood. And it's also very encouraging to see that the number of active cases in that facility is down to 1 resident and 1 staff member. So that's very good news indeed. And I really want to commend and thank the staff at Northwood and all the staff from across the health system who came to Northwood's assistance. We still aren't able to declare that outbreak over yet, but clearly things are headed in the right direction, and I want to thank everybody who's contributed to the work, ongoing work in Northwood. The QE2 lab continues to operate around the clock, and yesterday they processed 773 tests. So again, we're testing lots of people. We're not seeing positive cases, all of which is exactly what we wanted to have, and it's very good news. So for the numbers, we currently have 3 individuals in hospital, 2 of those in the intensive care. We now have 997 Nova Scotians who can be considered recovered from COVID-19, and 44,477 people have been tested and have received a negative result. Today is a day that I know many Nova Scotians have been looking forward to. I certainly have been looking forward to this. Many businesses are starting to reopen and people are starting to access a range of services again. I know some people are excited, some are anxious, many people are feeling a bit of both. And that's natural, and having these mixed feelings is probably the best and healthiest way to approach today and the days and weeks ahead. It's really good to see that people are able to get back to work, to become more social, have a bit more normalcy back in their lives. But we also need to remain cautious. That's why we're taking this slowly, and we have active monitoring and surveillance in place to very closely track the impact of our reopening on COVID-19. Over the past few weeks, myself, my team in public health, colleagues in occupational health and safety, and Office of Strategic Management in government have all been working very closely with businesses and other sectors to make sure they have the right information to develop reopening plans that adhere to public health measures and reduce risks. All the business sectors that were ordered closed under the public health order now have approved plans and are able to open. Sector organizations are taking the lead to communicate the sector plans to their individual members, and they're posting them on their own websites. We're also linking to plans from the government website, Reopening Nova Scotia. And if you need to find that website, if you just Google Reopening Nova Scotia, it'll come right up. I just want to remind the businesses that if they're the businesses that were ordered to close, that they have to follow their sector association's plan. Whether they're a member of that association or not, it's required that they follow the plan, the association, or the sector plan that has been approved by government. In a couple of instances, there have been a newly formed industry group, so a sector or an industry that didn't previously have an association have rapidly come together, create an association, which has been very helpful in terms of our ability to work with sector by sector. The body art industry is one, the fitness industry is another who've done that, and I was able to last night review and approve a plan for that will cover gyms, yoga studios, other types of fitness businesses and facilities. So people in those industries that if they who are wanting to know where they might find their association's plan, if they don't have if they're not clear about an association, again they can go to the government website, Reopening Nova Scotia, and they can link to find a plan that's appropriate for them. Businesses that were not specifically ordered closed under the public health order do need to have a plan, but they do not need to submit those to government for approval. I want to emphasize this because a lot of people are sending plans or asking about where do they submit their plans, and that's good. I'm encouraged that people are actually thinking about that and thinking that they have to have a plan submitted. But again, if you weren't specifically ordered closed, we want you to have a plan, but you don't need to submit that for approval. And the number of questions around this really, to me, is a good indication of how seriously the businesses are taking this and needing to have an appropriate plan to protect both worker and public safety. I want to thank all of the sectors, all the businesses that we've been working with for the tremendous job that they have done that allows us to be in where we're at today about reopening, but a reopening in a way that respects safety. Now I want to move on to kind of Nova Scotians themselves. While we've worked really hard with businesses, we need to remind yet again that Nova Scotians ultimately have to make their own decisions about the activities that they do, at the level of risk that they're comfortable with. Just because we're opening things up, individuals ultimately get to make their own choice about whether they feel comfortable and safe enough to take advantage of those opportunities. It's also important that all Nova Scotians that continue to keep up really good hand washing, cough hygiene, and especially staying home if you're feeling unwell. We need that to be part of our lives for many weeks and months ahead. We also need, as all Nova Scotians, we need to maintain physical distancing as much as we can, especially when we're out in public spaces, with the exception that if you're with your household or your family household bubble, with those individuals, you don't need to keep physical distance. I know this is going to be challenging, but to make this work, keep the reopening safe, everybody's going to need to be patient, accept the fact that there are going to be lineups, things are going to take more time, and that we're going to have to respect each other in terms of keeping physical distance. I saw another study released this week that came to the key conclusion it came to was that physical distancing was one of the key factors that minimizes the spread of COVID-19. So while we're getting out and about, back into our communities, back to work, important that we work with each other around maintaining physical distancing. I could be somewhere and doing everything I can to maintain physical distancing, but it also depends on everybody around me respecting each other's space. So it's important that we work together and follow these rules together to keep each other safe. We also need to respect that the gathering limit of 10 people is in place, except for when they're outdoor funerals and weddings that can have 15. That limit applies to social events, sporting activities, faith services, and arts and cultural events. These could be in our personal lives, or there may be events that are run by businesses. But when we have these types of activities, right now we're saying a maximum of 10 people, and they have to, if the people are outside of the household or household bubble, they have to maintain social distancing. I know that people are somewhat frustrated about this, but as I said previously, we have to open up the economy with businesses. We recognize the importance of social events. We will start to open those up, but we can't do everything all at once and introduce too much risk. So we ask for your patience, and we will look at how we slowly open up the ways that people can get together in larger numbers. It's important, again, I can't emphasize enough that we have to do this slowly and carefully. Now is not the time to have large gatherings of people. We know from all the evidence that these are the highest risk situations for creating significant transmission of COVID-19 and putting communities at risk. If we all follow the rules, use our common sense, and act with kindness towards one another, we will be in the best possible position to keep our curve flat and look as in the weeks ahead how we can further relax the public health restrictions. I was just talking about gatherings, and there are two types of specific gatherings that I want to talk in a little more detail. I know how important graduation is to students and their families. And like many other things in our lives, graduations are being disrupted this year by COVID-19. As the Premier has said, schools will recognize graduates and hand out diplomas. They have a specific protocols and processes in place for that. Separate from that, however, communities and community organizations have been asking if they can hold celebrations to recognize their local graduates. So effective today, I've made an exemption to the to the health protection order to allow these types of celebrations under strict conditions, and this will be in effect from June 8th to June 30th. I won't list all of them. They will be available on our COVID website, as well as in the news release that went out today, but there are some key items that I want to mention. First of all, that all non-school-based community celebrations of graduates must be held by a recognized business, municipality, or community organization. It's important that there is some organization that actually holds the responsibility for managing this according to the public health directive. We're also requiring that local municipality, the police and fire departments and EHS are informed about the event, and they have to be supportive of the event for it to happen as well. These are all going to be based around a drive-in concept, so attendees must arrive in a vehicle. All passengers in the vehicle must be from a single household or household bubble. Graduates can come out of their vehicle to do things like crossing a stage or taking part in a parade, as long as physical distance of 2 meters or 6 feet is maintained between all graduates while they're out of the vehicle. Where the organizers need to communicate clearly with attendees in advance of all the requirements of a specific event and ensure, like the public health protocols, they need to have a process to make sure that of monitoring to make sure the public health protocols are followed. As I said, the full list of conditions and protocols will be on our website. They're also going to be communicated out in a number of ways by government. All the usual rules and safety measures that everyone is familiar with will also apply. So we're making sure that people are aware of the importance of washing hands. So for instance, our recommendation would be if you're in one of these drive-in events that you bring hand sanitizer with you. That it's expected that anybody else, if you have to get out of the car, there will be washrooms available potentially at different events. That if you have to use the washroom, that you maintain the physical distance as required. It's important that anybody is feeling unwell on the day of these events, whether they're, unfortunately, we need to say this, whether they're a graduate or a family member, if they're unwell, they should not go to these events. And it's also people who are themselves may have a high risk for getting a severe illness from COVID-19. They want to think carefully about how much risk they put upon themselves by attending an event like this. We also are encouraging people who attend to consider wearing having a non-medical mask with them and wearing that mask if they get out of the vehicle. These events are not being organized or approved by the province. We say the criteria that I've just gone through and the one thing and more detail on the website will be provided, and local organizations, as I've outlined, can organize these events. The expectation and the requirement is that they follow the events according to the criteria that have been applied under this exemption. This has been done to allow communities to recognize graduates while at the same time maintaining health and safety. I want to be clear that these are organized events. This is not an exemption for individual grad parties. It is only for organized community-led events. Individual parties need to be held following the rules around 10 people or less, maintaining social distance. Living with COVID-19 requires a continual balance for all of us in the days and weeks and months ahead. It's unfortunate that students leaving school this year won't have a traditional grad ceremony or prom, but we do want to find a way to support communities to recognize these students, but again, doing this in a safe manner. The other gathering I want to talk about today is protests. Both the Premier and I spoke about this the other day, and I think it's important to bring this up again, as I understand there are more public demonstrations and protests planned for this weekend. We want all Nova Scotians to be safe, and that is our focus. But we also know that people have the right to organize and make their opinions known. That is also a critically important function of our democratic society. We respect the right for peaceful process, and certainly in the message that's been delivered on the protests that have happened earlier this week and the protest plan for this weekend, the Premier and I fully support the message behind those protests. These are fundamentally, but however, it's important to recognize that the protests are fundamentally a different type of gathering than a planned social gathering or the other events that have limits on the number of people who can attend. These demonstrations and protests, people have a right to that under our Constitution, and we need to allow those to happen. But what we're asking for is that they happen in a way that respects safety. It's always been important that safety is respected in any kind of demonstration in many ways, and now we have to add on a layer of COVID safety. So it's critically important that we ask that any participants going to any of the events maintain the social distance. Anybody organizing these events should consider how they're going to facilitate the maintenance of social distance. We would highly recommend that anybody going to these events wear a non-medical mask, and that we plead that anybody who is feeling unwell do not attend any of these events. And if people are at these events and they begin to feel unwell, then they should leave, and then anybody unwell can do an 811 online assessment. But it's very important that while we allow these events to happen, at the end of the day, the Nova Scotians who want to participate need to respect that these are creating an additional risk of COVID-19, and you have to respect your fellow Nova Scotians and protest in a manner that is safe and does not create a substantive risk of a reintroduction and a spark of a COVID-19 outbreak. And I'll finish off by talking briefly about long-term care and visits by family. Many things are opening up in Nova Scotia, but we still have restrictions on visiting and long-term care. I understand the desire for people, families to get together with their loved ones who are residents in long-term care. The last few months have been very challenging for everybody, both for the residents and for families. However, we have to also appreciate that the residents, your loved one, are at a very high risk of severe illness if they get COVID-19. And having COVID-19, as we're well aware in Nova Scotia, in a long-term care facility is a very difficult and challenging situation that puts a lot of people at risk. So we are working at ways we can start to create visits between families and residents in long-term care. We're looking at a number of options, working through some of the feasibility and the logistics with long-term care operators, and we hope as early as next week to start to bring something forward to in a cautious way to that visitation to happen. In the meantime, we certainly encourage people to continue to use video chats, phone calls, and other ways to stay connected. And I'll conclude by saying, as things reopen and as we start to create our new normal, I want to come back to the message that I've used from the very beginning, that ultimately we are all in this together. This is about doing things that allow each of us to respect the safety of our neighbors, the safety of our healthcare workers, the safety of those who we may not even know but are much more vulnerable in our communities. So it's not about us; it's about each other. And by acting together and caring about each other, so acts of the kindness, the patience for each other, and ultimately using the common sense. That's what will continue. I want people to ask people to continue to focus on that, and that's what will carry us forward and allow us to continue to reopen in a safe manner. So I'll end by encouraging people to get out, enjoy some of the things that are reopening, support our local businesses, local organizations as we start to recover our economy, but please do that safely. Premier.
Thank you, Dr. Strang. And Chrissy will take any questions.
Just a reminder that we'll take one question and one follow-up in the amount of time that we have for today. First question will go to CTV's Natasha Pace.
Thank you very much. I just wanted to start off by asking either the Premier or Dr. Strang about Northwood. I understand that Northwood is now in talks to return some of the recovered residents who have been staying at the off-site hotel recovery unit back to the home in Halifax. And I'm wondering if that means that residents will resume sharing rooms, or is there any plan around that?
So I'm aware of what you're talking about in terms of bringing those plans. I think as they bring that back, they're clearly aware of the challenges around sharing rooms. I don't know the details about specifically how they're going to do that, but I do know that they're aware of how they minimize that, and we need maintaining some of that individual rooms as much as possible. But I think you'd have to ask Northwood about the details about that plan.
Natasha, do you have a follow-up?
I do. Thank you. I also wanted to ask about another one about Northwood. The NSGEU says all the members that were mandated to work there from the Halifax Infirmary have now finished their work at Northwood. And I'm wondering whether or not you're concerned about any staffing challenges, and if you feel there's now enough staff at Northwood to properly care for residents going forward.
So we have a team that's still there. My colleagues in the Department of Health and Wellness are directly involved, and I read their kind of email updates. And what I'm seeing is that the staffing challenges have been resolved, have been that way for several weeks. They're not aware of any staffing challenges at this point in time at Northwood.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. As we progress into reopening, does the province have any plans to implement widespread antibody testing?
So you're talking about the serological test. That is still under review by at the national level. A serological test has been approved by Health Canada, but it's under review. Like any test, even though it's approved, doesn't mean it's been actually validated and how well it performs in terms of the characteristics of the test. And so that's underway. Additionally, there's also discussion about what's the appropriate way to use a serological test. That it may be a while before we just have it available that anybody could just walk into their doctor's office and see if they've been immune or not. There's all discussions underway about different ways to do what we call a serosurvey, where you have a broad population of Canadians who are tested to understand what's the percentage of Canadians who might have developed immunity with the first wave. So there's a number of things that are still need to be worked through before we can have widespread use of any serological test.
Lindsay, go ahead with your follow-up.
Thank you. Statistics Canada has a report out today showing that provincial unemployment for men increased by 0.4%, whereas unemployment for women is up nearly 6%. That's 14,500 more unemployed women since April. I'm hearing from women who are unable to work because their daycares aren't open yet, or they may not make it into the 50% of available spots. Is the province considering additional measures to meet urgent childcare needs?
So, as you know, the plan has been approved by Dr. Strang of Public Health around daycares across our province. We're looking forward to the 15th. As you know, there was also those that would not fall under government guidelines that are operating the at-home daycares. They're fully operational now, and we'll work with organizations if those spots are not enough to be able to fill the need.
Next question will go to Mike Gorman with CBC.
Thanks. Premier, we heard today from the Prime Minister a little bit of detail about this $14 billion restart package that's being offered to provinces. Based on the information you've been provided so far from he and the Deputy Prime Minister, what does that look like for Nova Scotia, and how might that money be used here?
Well, those details are still being worked out between our teams across the country. I will say a number of the topics that the Prime Minister was talking about was working with our municipalities around funding, and of course we want to work with the national government to be able to support a funding package for municipalities. Same time talking about the sick days that he has been talking about as part of that. There's some other issues around PPE as we continue to open up the economy. It's for 6 to 8 months window. I was pleased to hear the Prime Minister recognize that there are unique needs in individual provinces needing flexibility to be able to respond to those, and at the same time recognizing that all of this money may not be distributed on a per capita basis. It actually may go out based on need.
Mike, go ahead with your follow-up.
Premier, what would you identify some of the unique needs in Nova Scotia that you would hope that money would address?
Well, the flexibility around us to be able to respond to our municipalities. Transit is obviously a major issue under our public health order. The transit was deemed as essential service. We were obviously at the same time restricting ridership. So there's been a big cost associated with that, how to respond to that, helping municipalities to ensure the services they provide to their residents continue there. And again, working with our private sector as we continue to open up the province. We're going to have to learn to live with COVID. COVID is going to be here for a while, but we need to open up our economy and our province. As Dr. Strang has mentioned, today is a big day for our province. We're going to follow the epidemiology the coming weeks, looking hopefully then start opening up a bit more. It may require some support to businesses and communities, how we do that. And then we need to look at our own borders, whether it's in Atlantic Canada, I think is probably the appropriate start, looking at what Atlantic Canada bubble may look like. But again, looking at how do we get people, and both from a tourist point of view, from a business point of view, moving across this country as we live with COVID. I 100% believe we and other governments did the right thing a few months ago by shutting down our economies. We probably took a much more aggressive step here. closing businesses. But now that Canadians and Nova Scotians are well adhered to the public health protocols, we need to now figure out how can we best open up that economy to get commerce and activity moving respectively inside of our own province and, quite frankly, around the region.
Next question will go to Alicia Draus with Global.
Thank you. Earlier in this pandemic, we saw a lot of tickets handed out to people who were in parks when they were closed, even if they were just by themselves. Now, I'm wondering, with the public health guidelines mandating that only households or bubble households can be within 6 feet of each other, meaning they wouldn't be able to sit together at a restaurant, is there any way to actually enforce that, or is this something that will be enforced? Restaurants have told me that it's not up to them to be policing these family bubbles.
Well, it will be up to restaurants to be able to identify people coming in, and it's up to all of us, quite frankly. If people want to continue to have our economy open up, they're going to have to follow the public health protocols. We know all too well how quickly this virus travels. Do people want to go back to where we were 2 months ago, or do they want to continue to gradually try to open up our economy, remove restrictions from each other and our mobility? That's the most important thing, and it's up to all of us. We saw early on, we could put in all the rules and regulations. If people don't want to follow them, it's difficult to enforce them, even when we were putting in those fines. This is up to all of us. We know what happens to our physical health with this virus. We are all, a good number of Nova Scotians understand the economic consequences of this. So, as I said early on, follow the public health protocols because we have a responsibility to each other to protect each other's health. I would also say to you today, follow the public health protocols because we have a responsibility to support and protect the economic health of this province. And that's what this is about.
Go ahead with your follow-up, Alicia.
Yeah, I'm just looking for a little bit more clarity on some of the numbers for COVID-19. If you take a look at the number of cases that we've had and you get rid of the deaths and the recovered cases, it's left with 0 active cases. But I know that today you said there's still 3 people in hospital and the 2 associated with Northwood. So can you just clarify what's going on with the numbers there?
So I'd have to look at that. I think as we've talked about it before, our total number of cases also can include some people that are maybe have come here from another province for whatever reason, or a test that's come here and from another province, as we talked about the other day. So there's often a bit of reconciliation that has to happen, and that can take a bit of time to clarify some of these numbers. So I'd have to look at that in more detail, but we have, as we've talked about before, we periodically do that reconciliation, and sometimes there's some corrections to numbers.
Next question will go to Chris Halef with News 95.7.
Thank you. Yes, this question is for the Premier. It's on behalf of a colleague. Premier, you said Tuesday that parents will not have to pay to hold their child care spot if they don't plan on returning right away when daycares reopen. And in a release, government said that they will continue to provide funding on a sliding scale to cover those not planning on returning yet. However, in documents given to operators recently, there is some potentially conflicting information saying centers would only be eligible to have half of their spaces covered. There are some centers reporting they would have very low numbers if they reopen now, or on the 15th rather, meaning they could be operating below the 50% capacity limit. So my question is, will they be eligible for funding to cover all spaces that aren't occupied or only half of them?
As you know, not all spaces would have any subsidy attached to them. There are those that would have subsidy attached to them. What we have said for the 50% that are not eligible to open right now, we would cover that. If the protocol and the program has that number changing throughout the summer, so that'll go above 50% to a higher number. We would continue, though, to support the ones that we have kept closed. One of your colleagues previously asked a question around childcare. I believe those facilities that open up will get the support of Nova Scotians who require childcare and support. And what we've said for those that we're keeping closed, we would keep our subsidy in place.
Chris, go ahead with your follow-up.
Yeah, just to kind of, continue on that train of thought there. So, like those daycares that I've spoken to who said that if they reopen, only some of their spots would be filled, so they'd be operating below that 50% capacity. I guess my question would be, like, is there any plans to help those daycare owners because they may have difficulty surviving without funding to cover all unoccupied spot as opposed to 50%?
Well, I'm very proud of the work our government has done. Minister Churchill and his department with early childhood and child care centres across the province. We continue to invest and make sure that we kept those facilities whole through this entire period of time. We are going through a gradual opening where 50% of their occupancy will be allowed to use. We will cover the rest of those seats that are not there. And as we gradually continue to lift that number, the subsidy will decrease as we begin to move back to a normal activity within our child care sector. And we will work with our operators as we have as a government from the very beginning. And I want to thank all of those childcare workers who will be back to work on June 15th to ensure that our children and families who require childcare will have access to the top quality childcare that they've become accustomed to.
Next question will go to Olivier Lefebvre with Radio Canada.
Merci. Beginning June 9th, New Brunswick, anyone entering a building open to the general public will be required to wear face cover. So I was wondering, should Nova Scotians, people of Nova Scotia, expect a rule like this coming in the province?
So when we look at the national guidance around masks, they say that the public wearing non-medical masks is recommended based on the local epidemiology. I'm very comfortable right now with the level of COVID-19 that we have. That we have the appropriate recommendation is that Nova Scotians should consider wearing a non-medical mask if they're out in public in a place where they may be around other people and social distancing cannot be assured of being maintained. At this point, with the low level of virus, I think that is an appropriate recommendation. If the virus starts to return and we see increasing levels, we can certainly look at strengthening the language and of how the strength of our recommendation around masks.
Olivier, do you have a follow-up?
Yeah, sure. When we look at the data for the cases in the province, we see that almost 2/3 of the cases are women. It's different in Quebec, in Ontario. So I was wondering, do you have an answer why it's like this in Nova Scotia?
If we look at the majority of our cases have been in long-term care. We've had a significant proportion, most of those from Northwood. So we look at two things: that we know that there's a significantly higher percentage of long-term care residents are men as opposed to women. Women have on average, longer length of life. We also know that the majority of the workforce in long-term care residences are women. So you put those two together, that's the explanation of why we have a higher preponderance of our cases are women than the breakdown, the general gender breakdown in society.
Next question will go to Zane Woodford with the Halifax Examiner. Zane, are you on the line?
Thank you. This is a question for the Premier. I'm wondering if you're considering changing the terms of the short-term loan you're giving to municipalities. It currently has to be paid back within 3 years. Are you considering changing that to 5 years?
Minister Porter has been working with the UNSM municipal leaders across the province, looking for and providing flexibility on the terms of that loan. And that is ongoing.
Zane, go ahead with your follow-up.
Thanks. For Dr. Strang, the graduate celebrations, you say people must arrive in a vehicle. What would you say to families that don't have a vehicle?
So I know that's the community. Some of the community plans that have been seen is that actually local dealers have been willing to provide cars for the evening for those families. So I think that's an issue that already seeing communities stepping up, recognizing that as a challenge, and finding ways within their community to support that.
Next question will go to Bill Martin with Six Rivers News. Bill, are you on the line?
Yes, sorry, I had difficulty with the mute button. It's very clear, and as Dr. Strang just said, very pleased with the current COVID numbers in Nova Scotia, that if there is a threat for a second wave, it very likely is to come from outside the province. And we've asked before about whether or not there's any thought about strengthening the rules and regulations around those entering the province. The Premier has made it clear that he's quite pleased with the way Nova Scotians responded. But given the size of that potential threat, should we be considering perhaps some extra regulations tied strictly to those entering the province?
I think it's important that we recognize the public health protocols that are not only unique to this province but across the country. I think we need to recognize that while we are protecting the health of our population, we have to do it at the same time as we try to build an economy operating with these rules, which are very different for businesses and communities. We're going to have COVID for a while. There's no question about it. We can't shut our economy down. We can't tell people to stay home for indefinitely. People have to be able to make a living and support their families and try to keep their businesses going. So part of this will require the cooperation and support of all of us. I go back to one of your colleagues' questions around restaurants and policing them. We have to police ourselves at some point here. We have to recognize that if we don't do this together, then we will fall backwards. And that's the same thing when it comes to gradually opening up our province internally with our borders with our sister provinces and neighbors. But at the same time, Canada's going to have to figure out how we can open up our economy and travel, and that will have to take place. We'll have to be brave enough to take that step at some point into the future, but we'll do that in conjunction with public health and when the epidemiology tells us this is the right time to take that step.
Bill, do you have a follow-up?
Again, to the Premier, I quite agree with what you're saying in terms of us all taking our own responsibility. But if the greatest threat indeed is from those who come to us rather than from within the province, I'm not suggesting that we shut off travel or visitors coming to the province, but considering other ways to make certain that we are protected once they get here.
Well, there's no question. The best way we can do that is follow public health protocols, not only those of us that live in this province, but those who want to come and visit. So currently, right now, you need to self-isolate for 14 days, as you do in our sister provinces. At some point, 14 days does not make it attractive to come and visit our province, to come and spend money here, to come and drive the economic opportunities and job creation that takes place here, or vice versa for us to go to another province. But if we get to the point where we protect our own health through public health protocols, and then demand those that are coming in to continue to follow those, like the 6 feet separation, washing your hands diligently, making sure that business owners continue to do the proper cleaning process that happens, same as our tourism icons, continue to make sure we're doing the appropriate cleaning. We need to be able to do that as we monitor the risk. As you know, in our sister province of Atlantic Canada, had not have as much of the virus as we have. We've been able to flatten the curve they have, and I hope at some point they recognize that we need mobility for the economic health of this province at the same time as we continue to practice the public health protocols that protects our public health.
And that's all the time. Oh.
Add to that, because I think it's important to understand that that rule of 14 days has actually worked, and without having stronger restrictions around it. That we've had a number of cases that people have been identified with COVID-19, and they've already been self-isolating when they got sick and were tested. And because they took that action, there was minimal exposure to other Nova Scotians. And one of our recent cases was exactly that. Somebody who, for work reasons, was outside of the province, came back, self-isolated, then became sick and tested. So all the evidence we have is that, and we haven't had cases that have had, by and large, where there's been widespread from people that we've been aware of have been willfully not obeying the 14-day isolation period. So the restriction we have and the level of oversight of that, what I've seen in the last 3 months has served us well.
And that's all the time that we have today for questions.
Thank you, Christine. Thanks, Dr. Strang. What a day it is for our province. As I was out for my walk, I saw it was great to see doors opening, welcoming signs and balloons. To the business that opened today, well done. Congratulations. I know it's not easy. Your capacity is down, and you have a lot of public health protocols to follow. But we're getting there. Just opening today is a big deal, and the next 2 weeks are critical for all of us. Public health will be monitoring and testing, and if we can keep the cases down, we will continue to open up. Stay strong and stick with it. Be safe and be patient. To the rest of us, we owe it to these businesses to support them. Go to a restaurant or order a takeout. Get your hair cut. Go to the gym. Go shopping. Whatever you choose to do, think local, buy local, and support local. Yes, we have to be safe and we have to follow the protocols. But, as I said earlier in one of my answers, we have to take this step. Dr. Strang and I are confident in all of you to help make this work. We have got this. We have got this. We are Nova Scotia strong, and we are Nova Scotia proud.